Okay.
All right, Jennifer, welcome to Clearskin. How are you today?
Good, thank you.
Good. Well, I see in the paperwork that you are already scheduled for face, neck, and chest, and you've decided for CO2 resurfacing, and you've decided to add your hands today just to kind of see what it's about and to do that. Is that correct?
Yes, please.
Okay. Well, the CO2, I'm just going to review a little bit. You may remember the packet that we gave you on CO2 resurfacing and with all the take-home instructions and everything?
Yes.
You have that? Okay. Well, this is very, very similar. We are going to do basically from your fingernail all the way up to your wrist, and the treatment itself will only take about 5 minutes for both hands. So this is not going to take very long, but what it will do is very similar to what it does on your face, neck, and chest, and that is we're going to be putting in a lot of holes, and those holes are replaced with your good, healthy skin. So you're going to grow new skin in place. So you might get 20 or 30 or 40% all brand new skin in simply one treatment. And when that happens, you will also get collagen, so you get skin tightening at the same time. Okay?
Great.
When we do on the body, we typically will do hands, sometimes lower arms, sometimes upper arms, shoulders, we've done backs, we've done full legs. So just so that you know, besides the face, neck, and chest, we do full body CO2 resurfacing, and we do it using different protocols. So the protocols on the extremities, we do reduce the setting, and it takes about 2 to 3 weeks for it to completely flake. And again, you will be going home with our kit that has everything included with the ointment that you use and the cleanser and everything that you need. Okay?
Very good.
So this won't take long, very easy to do. As far as afterwards, we'll be applying the ointment, and you will need sunblock if you're out in the sun, of course. And you will have just a sunburn type sensation for a few hours, and that calms down about 20 to 30% per hour, and by tonight you won't feel like much of anything. It will be red for a while, and you can notice a little bit of swelling. Some people do, some people don't. On your face, neck, and chest, especially on your face, you will notice that, as we discussed. In 2 or 3 weeks, it's going to flake off, and what you'll be replaced with is brand new skin, as I mentioned. It makes it tighter and smoother, and people love it.
Wonderful.
Okay, any other questions?
You don't use topical for this because it's lighter?
You won't need to. No. If we were doing maybe your neck and chest in addition to your face, then what we use is numbing cream on your face, neck, and chest. And so you do have the numbing cream because we do typically the face much more aggressively. And so as one unit, treatment unit, or area, we do put numbing cream on for that. But normally we do not need to for the extremities.
Okay.
All right? Okay, then we'll go ahead and get started.
Very good.
Go ahead.
All right, are you ready to get started? All right, here we go. Now, how's that feeling?
Great. Not, I shouldn't say great, but it's not bad.
Okay.
Just slightly warm, but it cools off right away.
Yeah, most people don't object to this treatment at all, even though it does a really nice job.
I can't wait. You can see it's making a difference as it goes along.
Well, you're getting a lot of holes. The tightness of the holes, the pitch, what we call the pitch here, is 300. So you're getting a lot of holes that are going to be replaced with brand new healthy skin.
Good.
So I'm just doing your hand first, and then I'll come down and do your fingers. And most people find this to be a very easy to do treatment. They don't mind it, and the benefits pretty dramatic.
I'm excited. I've never liked the look of my hands. My skin, I don't know, just I'll go for the improvement.
All right. Let's get one more row right in here.
Okay.
And if you'll lift a little bit, oh, turn just like that.
Okay.
Exactly. And let's get it one more in here. A little bit of overlap. Now is it starting to heat up just a little bit?
Only when you're going over it. It actually doesn't stay too hot.
Okay. So far so good?
So far so good.
Alright, let's go ahead then and let's start with your finger. And we'll just take it right down the side here. We can adjust this to any size we need. So the advantage to this is it's very quick, it's very easy. Most people don't find it to be that uncomfortable at all.
No.
And the rewards are tremendous.
And hands are so important. They can aid you.
Exactly. Well, again, if you're doing your face, neck, chest, it's really nice to complement that with your hands at the same time, or about the same time, so that everything comes together at one time. So this is going to work out really well for you.
It's covering everything so nicely.
Exactly. Now it is going to heat up just a little bit over time, and then it starts to cool down.
Should I just
So
put ice packs on it?
you
Or?
can if you like. It's not really, most people don't find it to be that bad or that annoying, but you certainly can if it becomes uncomfortable. And that's it.
Very good.
How's that?
Great.
Alright, well we'll do the same thing on your other hand, and then you may want to consider doing your arms at another time.
Okay. Thank
Alright,
you.
You're welcome.
Okay.
Alright, we'll start right here and go across here.
Recapturing my youth.
Exactly. This is a fairly easy, benign treatment. Patients tolerate it very well.
Yeah, it isn't, it's a little hot, but it's not something that bothers you. I don't feel like I have to flinch or something.
This is the sort of thing that if a patient does this a few times, just a month apart or so, maybe 5-6 weeks, it really starts to add up and make a tremendous difference for them.
Well, I can't wait. My hands look so old. They're dry and crepey looking, and I would love to have that tightening.
Well, we started doing extremities, areas other than just the face, neck, and chest about a year ago. And we found that patients absolutely love having their hands and arms, and now we're doing legs, and we've done backs, and so there's just about any area. And if for women that might have stretch marks, it's a fabulous treatment for stretch marks and scars.
Really? Stretch marks?
Absolutely. And so you can make quite a difference just in smoothing out the peaks and getting some collagen in the valleys, so to speak. Makes a very, very nice difference for the patient.
I like that collagen in the valleys.
Yeah, it helps. As we age, we need all that kind of help.
It sure doesn't take long.
No, this is very easy. How's this feeling now?
I'm just having, it's fun to watch. It's not bad at all. I'm helping you, watching all the places you're going over.
You've been a great help. Just want to get this area right across here.
Yep.
Let's do one more pass in between.
Okay.
Make sure we get that really good. And let's get right across here.
Now you say there might be a little swelling?
It's possible. Some people will have a little swelling in an area. It's not bad. It doesn't last long. The more aggressive we are, the more likely you have swelling in an area. And like when we do your face, we expect you to have swelling. Swelling is an inflammatory response, and we would expect you to have swelling. And it seems like all of our patients who have quite a bit of swelling turn out really, really well.
They develop collagen?
Exactly. That's what it's all about after age 35.
Very good.
All set?
Yes, thank you.
You're very welcome.